England's 4-week lockdown could last longer than its scheduled end date of December the 2nd. The Cabinet Minister Michael Gove said ministers will be guided by the facts and that the government wanted to get the coronavirus reproduction rate below the critical level of 1. The new measures, which come into force on Thursday, include the requirement to stay at home, only leaving for specific reasons such as work or education. Outdoor exercise is encouraged, but you can only meet up to exercise with one person outside your household. There's no household mixing indoors or in private gardens unless part of a support bubble. And pubs, restaurants and non-essential shops will have to close. We'll have more on all the measures and their implications shortly. But first, here's our political correspondent, Jonathan Blake.
A round of golf while it's still allowed. Here in Hertfordshire, only the minimum restrictions are currently in place. But like the rest of England, people are now preparing for a new national lockdown.
I think it's frustrating here because the cases aren't that bad and we have all been, following the rules that we were given.
So while people may not agree with it, we've got to stick with it. So it's a bit frustrating, yes, but rules are rules.
The lockdown is due to last until the 2nd of December, but a senior government minister said that was a hope, not a guarantee, and left open the option of restrictions staying in place for longer.
If we ensure that all the steps that we're taking now are taken appropriately, we'll have an opportunity in advance of December the 2nd to review the progress that we're making, and in advance of December the 2nd, we can then communicate to those areas where some restrictions may be required, what they will be, and also other areas where we've managed to beat back the virus, we can explain where liberties can be restored.
Labour say they'll support the plan, but their leader is adamant it should have happened sooner.
If what they announced yesterday had been announced when I said it should have been 2 or 3 weeks ago, we could have had the lockdown and schools shut because of the natural break of half term. And people will be waking up this morning and thinking, how on earth did it get to this? The government has to keep its side of the bargain here, because if they don't use this time to fix, test, trace and isolate, then I think the 2nd of December will be a review date, not an end date.
With Labour's support, the national lockdown is likely to pass a vote in Parliament later this week, but some Conservatives are dead against it. The senior Tory backbencher, Sir Graham Brady, has told the BBC this repetitive cycle of lockdowns is immensely damaging to people's livelihoods and causing a huge toll. He and others are unlikely to be able to stop the government's plans, but they are speaking out in the strongest terms. There's concern too about where the lockdown leads. One scientist advising the government said a return to regional restrictions is unrealistic.
What mustn't happen is whenever that date comes, 2nd of December or a little bit later, that suddenly the world goes back to normal. It's not going to go back to normal immediately. I think it will be at least what is currently called Tier 3 or Tier 3 plus across the country. I don't think it makes sense to go back into regional variation in the restrictions that are in place immediately after this set of more draconian measures are lifted.
In Scotland, a new 5-tier system of regional restrictions comes into force tomorrow. Wales is midway through a month-long firebreak lockdown, and slightly looser restrictions are in place across Northern Ireland. Police said up to 700 people attended this illegal rave near Bristol last night, openly breaking the rules already in place. But this week will bring new limitations for everyone in England as the government's last resort becomes a reality. Jonathan Blake, BBC News.
I'm joined by our Deputy Political Editor, Vicky Young. Vicky, a busy last 24 hours and a busy week ahead.
Well, yes, and you think about the Foreign Secretary, seems like a long time ago that he was on the TV saying that it would be desperately unfair to go for a national lockdown. Well, that was just 2 days ago, and it does show how suddenly the government abandoned this local approach and has gone for what Boris Johnson called the nuclear option. Now, politically, this is extremely problematic for him. Partly, the warnings were there from the scientists quite some time ago, and, of course, the Labour leader called for just this kind of approach. But he's also got a problem with some of his own MPs. The Prime Minister has to go to Parliament at least twice this week asking for their support. Some of them, as we've heard, extremely unhappy about all of this on libertarian grounds. One senior MP calling it something like a totalitarian state. They're also worried about an exit strategy. And so what Michael Gove said there is not going to help. The idea that it's a hope that all this ends on the 2nd of December, and lots of people fearing that for many, millions maybe in England, it could go on for a lot longer than that. But there is another concern, and that's about the decision-making in Downing Street. The way that this really important decision tumbled out in quite a chaotic way, they're worried that it makes it look like they are incompetent. As one minister put it to me, he said, "We all know that the virus is hard to control, but the government has to be able to control its own message at this time."
Vicky, thank you very much. The latest government figures show there were 23,254 new coronavirus infections recorded in the latest 24-hour period. That means that the average number of new cases reported per day in the last week is now 23,016. 162 deaths were reported. That's people who died within 28 days of a positive COVID-19 test. It means, on average, in the past week, 260 deaths were announced every day. It takes the total number of deaths so far across the UK to 46,717. This latest lockdown has been prompted by the recent rises in infection rates. But what are the other key indicators which would allow restrictions to be eased? Here's our health correspondent Lauren Moss.
From Thursday, the message in England will once again be stay home to save lives. Non-essential shops and hospitality will close. Schools and universities will stay open. The Prime Minister has said the measures are to prevent a medical disaster of the NHS being overwhelmed.
Well, I think the Prime Minister had no choice but to act on very clear evidence that the trajectory of hospital admissions, demand of the health service was such that we just would have been overwhelmed in the coming weeks, to the point that it wouldn't just be a case of not managing the surge in patients with COVID, but actually the NHS would not have been able to provide services to large numbers of non-COVID patients.
There are more than 9,000 people with COVID in English hospitals. Some, including those in Liverpool, Lancashire and Nottinghamshire, are treating more coronavirus patients now than during the peak in the first wave. Getting the reproduction number of the virus below 1 is crucial. Anything above that means it's spreading.
In September, scientists looked at the effect different interventions could have on the R number, which is thought to be around 1.2 at the minute. A full lockdown, like we had in March, that included schools closing, would have the biggest impact. It's thought the measures introduced in the spring reduced the R by around 75%. They estimated closing pubs, restaurants, bars and cafes would have a moderate impact on transmission, bringing R down by around 0.1 to 0.2. And they also considered the closure of non-essential retail and found that on its own this would have a minimal impact. There is a level of uncertainty around these figures, and they're based on data before cases reach the severity they're at now. But it's hoped the measures being introduced will bring that R number down.
Lockdown isn't a long-term solution, though.
You have to use it as an opportunity to improve the test, trace and isolation, and that is an exit strategy. And until we get mass testing up and running with fast turnarounds, and it's the fast turnaround. There's no use having a system that waits 5 days for a test result to come, because you can't get ahead of the virus.
The Prime Minister has promised that a rollout of rapid testing, which will give results within 15 minutes, is imminent. Care has also advanced since March. The sickest patients can now be treated with the steroid dexamethasone, and some Nightingale hospitals are on standby. Many hopes are pinned on a vaccine, with scientists predicting positive results by the end of the year. Until then, reducing the spread of the virus and limiting its effect are the only ways of indicating how long this latest lockdown will last. Lauren Moss, BBC News.